Afternoon. I'm Carice Turner-Smith, Director of Grant Making and Community Partnerships at United Way of Greater Cleveland. Welcome to our webinar on the United Way 2025 ALICE Report. Since 2017, United Way has released the annual Asset Limited Income Constrained Employed, or ALICE report, focusing on individuals and families in our community who earn just above the federal poverty level, but less than what it costs to make ends meet. Federal poverty level data does not truly capture the financial struggle of individuals throughout our communities. Our clients, neighbors, friends, family members, and colleagues are ALICE, and these households are represented in every county in Ohio. Today, you will hear from 3 speakers about the 2025 ALICE report and ways they are incorporating the data and findings into their work to assist ALICE households in the community. Our first speaker is Miriam Kiefer, Director of Public Policy at United Way of Greater Cleveland. Miriam will go over the 2025 ALICE report for Ohio and specific data for Cuyahoga and Geauga counties. Miriam has over a decade of experience working in public policy and government affairs and advocates for advancements in health and human service programs and funding, including Medicaid, SNAP, TANF, mental health, and substance use programs. An audience Q&A will follow Miriam's presentation. Following the presentation, Sarah Myers, a mental health peer and support supervisor at Ravenwood Health, and Sarah Welch, self-sufficiency case manager at Catholic Charities, will discuss their work in the Geauga Poverty Collaboration, an initiative funded by United Way of Greater Cleveland that provides community members in Geauga County up to $1,000 in one-time assistance for unexpected expenses and emergencies. After Sarah Myers and Sarah Welch's discussion, we will have time for questions from the audience on the Geauga Poverty Collaborative. You can type your questions in the Q&A box. In addition, this event will be recorded, and we will share the recording and Miriam's slides with all attendees and registrants. We will also post the recording on our YouTube channel. And with that, I will turn it over to Miriam to begin her presentation on the 2025 ALICE report.
I'm going to be giving an overview of the 2025 ALICE report, and kind of at the top, I'll go over the federal poverty lines and why the ALICE data is so important, because it really captures information beyond the federal poverty guidelines of those in our community that are struggling and unable to make ends meet. And then I'll go into the ALICE report. I'll talk about the Ohio data, and then I'll talk specifically about the Cuyahoga and Geauga data. And then I'll just give a brief walkthrough of the website. All right, so next slide, please. All right. So the federal poverty guidelines, this is kind of what is used to determine eligibility for a variety of different public benefit programs that probably many of you are familiar with and help individuals navigate, including programs like Medicaid, Head Start, SNAP, LIHEAP. This was created back in the 1960s, and basically the federal poverty guidelines, the calculation for them has not changed. Once it was created in the 1960s, we've just continued to use it, and it takes information on food. So it gets information on just the basic types of food that many households purchase across the country, things like rice, eggs, bread, chicken, meat. And back in 1955, individuals spent a third of their income on food. So how the federal poverty guidelines are calculated is they take these kind of basic costs of food, they multiply it out by 3, and then they multiply it out by family size. It adjusts every year for inflation, but the way that it's calculated has not changed since the 1960s. And next slide, Jem. And so this is what the federal poverty guidelines look like for the 48 contiguous U.S. states for the year of 2025. So for a family of 4, if you are above $32,150, you are not considered part of poverty here in the U.S. Hawaii and Alaska have separate poverty guidelines, but it doesn't matter if you live here in Cleveland or if you live in San Francisco or New York City. The federal poverty guidelines are the same in every part of the country. Next slide, please. So as I've mentioned, this only includes food. It does not include all the other things that a family needs to survive, like housing, childcare, food, transportation, healthcare, internet and smartphone access, and taxes. And so that's what's really important about the ALICE data, is that it captures all of this information and it drills it down to the county, to the city, to the zip code level, and shows for that area what the average cost of living is just for the basics. And then looks at the incomes in that area, and then looks at, okay, are people earning enough income to survive in that area? And then it computes both of those numbers, and then it shows the members of the community that do not have enough income just to meet that basic standard of living. And so ALICE stands for Asset Limited Income Constrained Employed. That's the acronym we use to capture these individuals who have incomes above the federal poverty line, but below what it costs to make ends meet. So they're not captured in that national data set on those that are struggling in our communities. And so that's why the ALICE data is so important. Next slide, please. And so the ALICE data uses federal public and federal data sources to compile all this information. So for income, they use the U.S. Census Bureau's American Community Survey. For household costs, they use the, thank you, Jen, the ACS household tabulated data, the public use microdata sample, and the Federal Reserve Board's survey of household economic and decision making, and the household pulse survey. Next slide, please. All right, so diving into the Ohio data. So according to the federal poverty level, only 14% of households in Ohio were in poverty in 2023. And just to mention, even though the data was, the report was released on Monday, the 2025 report, it does use data from 2 years prior. So all of the data I'm going to be citing is from 2023. So only 14% of households were in poverty, yet when we take into account all of that information on what the average cost of living is and what percentage of people do not have enough income to make ends meet just to cover those basic costs, and another 25% of households in Ohio were ALICE. And so that's 39% of the population in Ohio does not have enough income to make ends meet. So it's almost a little less than half of the state. Just to cover the basics in Ohio for a family of 4 is $65,000 a year. And for 2 children in childcare, it costs $79,000 per year. And 31% of households below the ALICE threshold, they do not have 3 months of expenses and emergency savings, and only 39% have any retirement assets. And so many of these families, they're living paycheck to paycheck. They don't have funds or resources if a crisis happens. All right, next slide, please. And this just shows the data year over year, and so what the trends have looked like. So poverty for over a decade now here in Ohio has remained relatively flat. However, individuals in the ALICE population have continued to increase. So as wages and incomes have risen, they have not risen fast enough to get people beyond that ALICE threshold, beyond the place where they're living paycheck to paycheck, where they're able to save money and weather a crisis. Also, the number of older adults in Ohio in the ALICE population have increased as well. So 49% of all households with older adults are below the ALICE threshold. So as our population continues to age, we might see that increase as well. All right, next slide, please. And so this just shows the household survival budget. Again, just the basics of what a family needs to make ends meet in the state. And so, as I mentioned, $65,000 for a family of four, almost $80,000 for two children, two adults, and two kids in childcare. And just press the button, Jen, just to show, this in comparison to the federal poverty line. It's almost, for just a family of four without kids in childcare, it's a little more than double. So we're at 65,000, 32 in comparison to the federal poverty line. If you have two kids in childcare, it's almost triple. And also, what it shows is the hourly wages as well, what you would need to earn per hour to sustain this family. So with two kids in childcare, you almost have to earn $40 per hour to make ends meet. Also, childcare is the highest line item in a family's budget. Childcare for two kids is $1,600 per month. It's more than rent, it's more than food, it's more than healthcare, and it's the highest expenditure in any family composition. So it's the highest line item on this table, just showing how expensive childcare is in the state. All right, and this slide shows information on different employment sectors and occupations that are below the ALICE threshold. And so of the top 20 jobs here, most common jobs here in Ohio, 14 pay less than $20 per hour. And for two occupations in particular, personal care aides and fast food and counter workers, almost 50% of their employees are below the ALICE threshold. So you'll be working multiple jobs or have many people in the family working, but still not have enough to make ends meet because wages have not kept up in pace with the cost of living. Next slide, please. And so what's also really wonderful about this year's report is that it shows the economic impact. If we were to bring all ALICE households just up to the ALICE threshold, that would generate $47.3 billion in new economic activity in Ohio and provide a 32% return on investment, equivalent to 7% of the state's GDP in 2023. So resources, assistance, policies directed at the ALICE population have a huge impact, not only on those individuals themselves and their families, but for the community and the economy as a whole. All right, next slide. So this is specific information on Cuyahoga County. Cuyahoga looks quite similar to the rest of the state, but is just slightly above in poverty and slightly above in ALICE, just for comparison. At the state level, it's 14% in poverty, so we're 2 points ahead. And for ALICE, also 2 points ahead at 25% for the state. What is particularly interesting in Cuyahoga County is that poverty has gone on this downward trajectory, which is good, but as people's income, which means people's incomes are increasing, they're working more, but again, they're not able to make ends meet as we see the ALICE threshold continue to rise for households in Cuyahoga County. Next slide, please. Cost of living in Cuyahoga County is slightly more than the state average. So for that family of four, for the state, it was around $65,000. For Cuyahoga County, it's $73,000. If you have two kids in childcare, it's almost $91,000. So again, your hourly salary needs to be around $45 to sustain a family of four with two kids in childcare in Cuyahoga County. And again, childcare being that highest expenditure at almost $2,000 a month. All right, and then this is what the data looks like across the county. So again, you can break down the data by neighborhood, and these are the neighborhoods with the highest percent of ALICE households. And these are neighborhoods with populations above 5,000, just to give an apples to apples comparison, because there are some neighborhoods in Cuyahoga County with populations of less than 1,000. So East Cleveland being the number one at 79%. So almost 80% of all households in East Cleveland do not have enough income to make ends meet. Cleveland coming at number two. The rest are around 50%, and then Mayfield, Richmond, and Bedford being around just above 40%. Right, next slide, please. Geauga County looks a little bit different than Cuyahoga County, but when we include the ALICE information, it really shows that individuals in Geauga County are also struggling as well. Kind of similarly to the state, poverty has remained relatively flat in Geauga County for the past several years. It's at 6% right now. Again, just in comparison to the state is 14, so it's 8 percentage points below the state average. However, ALICE is at 22%, and we've kind of seen ALICE kind of ebb and flow in Geauga County over the past decade. Again, in comparison to the state, 25% ALICE. So Geauga County is just 3 percentage points below the state in terms of ALICE. Next slide. The cost of living in Geauga County is almost exactly the same as Cuyahoga County. There's not much difference in these line items. And again, childcare being that highest cost in Geauga County, similar to Cuyahoga County. Next slide. And then this is what Geauga County looks like in terms of its neighborhoods and how ALICE looks throughout the county. Middlefield Village and Middlefield Township being at the top, then Chardon, Burton, and Clarendon. Just in comparison to Cuyahoga County, these are similar to Richmond Heights, Mayfield Heights, and Bedford Heights. All right, and next slide. All right, so just for the website demonstration, so Jen, I'm gonna have to ask you to share your screen. So these are the different sections in the website. The website has a wealth of information. All of the graphics I've pulled from the website. And Jen, if you could go to unitedforalice.org and share your screen, if that's all right, just so I can go through quickly some of the sections. Beautiful. All right, so we're gonna go to state data. And we're gonna click on Ohio. All right, so on your left, all of the key findings are there: the cost of basics, cost over time, demographics, ALICE in the labor force, trends in hardships, individual county reports, and indicators of well-being. So all the information I shared on the slide deck, that's all in there. And then Jen, I'm going to ask you to please click on Dig Deeper with ALICE Data Tools. I'm going to ask you to click on the Economic Viability Dashboard. This is a great data set where you can drill down to the county level, to the neighborhood level on specific areas of ALICE data. So looking at employment down to the county and sector, job sector level, what's the percentage of that workforce in the ALICE population? For housing, you could look at rent burden and owner burden. So the percentage of individuals that are paying over 30% or over 50% of their income for housing. In community, you can look at internet access, preschool access, and a couple of other areas of economic well-being. So really great data set. It breaks it down by race as well. For those of you that are doing any type of grant making or advocacy work, or want just more information on the communities that you serve or work in, this provides just a really great resource of information. And Jen, I'm going to ask you to look at one additional area. So for those of you that engage with legislators, there's a legislative district tool as well. And if you scroll down, and yep, perfect. And you can get the information for Ohio, for the Ohio House and Senate, and our congressional delegation as well. So if you have a meeting with a legislator and you want to show them information on their district, this is all available. All right, and so I know we are getting close to time. Just want to see if anybody has any questions. I don't see any in the Q&A box. All right, seeing no questions, I'm going to turn this back over to Carice, but thank you all so much. And
All right, thank you, Miriam, for your presentation on the 2025 ALICE report. Next, Sarah Myers and Sarah Welch will discuss their work with the Geauga Poverty Collective, a grantee partner of the United Way of Greater Cleveland. The collaborative brings together case managers from 7 different agencies in Geauga County to assist clients, particularly ALICE households, that are experiencing barriers to economic mobility. The case managers connect individuals with existing resources and, when necessary, provide funding to help access needed resources. Sarah Myers has been with Ravenwood Health for 13 years. Sarah started working with clients at Ravenwood in their employment program and transitioned to a case management position. Sarah Welch has worked in Geauga County for over 20 years in various capacities and participates in multiple boards within the community to advocate for the ALICE population and those who face barriers to self-sufficiency. Sarah is also working on her Master's of Social Work degree at Youngstown State. I will moderate a discussion with Sarah and Sarah on the Poverty Collaborative, and then we will have time for audience questions. Welcome, Sarah and Sarah. So my first question, if you all want to unmute, is what is the mission and purpose of the Geauga Poverty Collaborative, and how does it specifically serve the ALICE community in Geauga?
Rock, paper, scissors. Part of the collaborative is to kind of be able to help those, especially in the ALICE population, so they don't slide one way or the other. We do look at the federal poverty guidelines and all that, but a lot of the clients that do come through us are just kind of in a financial situation at the moment to be able to, like, one bill, one home improvement, one something away from possibly sliding farther down. So with our collaborative, we try to address those needs and help them stay stable, save in the more positive part of their financial ability.
Thank you.
So when we first started, I think 5 years ago at this point, we discussed, the initial 7 agencies discussed kind of what we wanted to do and how we wanted to serve the community. And we discussed that as a multidisciplinary team, that we could meet the needs of our community by pooling our knowledge of resources and everything available to the community, to mitigate the setbacks that the clients who are in the ALICE population tend to have that then cause them to slide into poverty. So often we meet and we discuss, hey, what's going on? Where else can we go? Who else can possibly help pool with us if we have to pay for anything, to help advocate for our clients. And we use our information that we get to continue to do outreach throughout the community for us as well.
Thank you. You mentioned that there are 7 agencies. Can you tell me who are the members of the collaborative and how did they come to be in the collaborative together with you all?
So it's myself from Catholic Charities, Sarah Myers from Ravenwood, Erin Munasami from Family Pride, Casey with Women's Safe. We have Next Step, which is the housing for youth transitioning out of foster care from 18 to 24. We have Lake Geauga Recovery Centers and Torchlight Youth Mentoring, which is the old Big Brothers Big Sisters program. Ravenwood is actually the lead program and funder on this one. They are the ones that we send for reimbursement for. And I believe it was in collaboration when the leaders started talking with United Way of, hey, you guys all collaborate really well together. As individuals, let's bring you to one table so you can work together.
Love it. Thank you. And how did the collaborative learn about the ALICE data, and how did it decide to use it to inform its work?
With the data, we've kind of seen like, sorry, brain, trends and different areas of concern in our county. Housing and transportation's always been a big issue, which we've realized, but we've come to find other different areas that clients are really struggling with. Whether it's getting assistance from school, whether it's simple court costs that are now affecting how they pay rent or get to work. Transportation, not even just getting to work, like a reliable car, reliable vehicle. We've kind of, as we're in this collaborative, we've kind of realized there's other areas as well that many other people may not see or think of that could potentially impact our residents here in Geauga County.
I agree with Sarah. I think that the nice thing about the collaborative is that it's allowed us to see the trends before they truly kind of take effect, to try to mitigate them. So most of us sit on multiple other boards as well, where we can advocate for, hey, this is what we're seeing, what's coming to us because we meet bi-weekly. Every 2 weeks, this is what we're seeing for people who are in need. And I think the collaborative itself kind of led into the stepping up community, which to serve those who are reentering the community from prison or jail systems, to how to help them more effectively as well. And it kind of has made us a stronger community because we know what's happening, so we can go to our leaders and go, hey, this is what we're seeing. How can we kind of use the money that we have to assist sooner so that we're not seeing more people fall into the poverty line?
And what are some of those impacts that you're seeing with the collaborative in the on individuals and in the community?
Okay.
So, I think what we've seen is a true, because what we're doing is life-saving money, right? Like we're providing a life-saving ability for somebody, where they're not having to choose between paying rent or putting food on their table, or paying for a car repair, to being able to stay at work. So we see that we're continuing to have people provide to the tax base of our community. We're seeing that we're able to help seniors who are still working because they have such a fixed income that they have to find a second job to supplement, to be able to provide for them so that they can stay and have a little more balance within their lives. We're being able to take people who are coming back to our community, who have substance use issues or mental health issues, and being able to keep them stable enough so they're not having to access other services. We're seeing, specifically for myself, a single dad who was a substance user and has been sober for 3 years, and we were able to help with funding for childcare for him, because that's one of those huge ones, so that he was able to maintain work because he was able to get custody of his 3 children. And because we were able to do that, he was able to complete with going through other stages to find housing that's suitable and find long-term employment and all of those things that without the collaborative wouldn't have been available to him.
And with that too, like usually when these clients come through to us, we kind of get into their financial things so we can assist with them afterwards too. So they are usually working with one of our agencies at some point then to help maintain. We're not just, oh, here's the help and we'll let you try and figure everything else. We try and make sure they are protected for the future.
Yeah, most of the people that are coming to the collaborative are with a case manager already within the agency. So they have goals already set of what they want to accomplish, and us being able to provide this is more of that long-term self-sufficiency plan of, hey, we're going to do this. It's not going to be something that we're going to have to come back to it later, because at that point we're involved working on budgeting, we're working on mental health case management, we're working on job readiness, we're working on all those skills that are needed to help make a household function long term.
Thank you. It sounds amazing. How do people get connected to the collaborative? Can you talk more about that process?
So at the beginning, we developed an application so that each of the case managers has the ability to bring in a client themselves. Ravenwood has way more case managers than like me. I'm the only one at my agency. So case managers bring applications to Sarah. Sarah brings them to collaborative. I bring them to collaborative, and we present. Those who are presenting do not, for lack of a better term, vote on what's there. They just provide the information, and the other 6 agencies then give feedback on, hey, let's try this, or yes, let's go ahead and approve this funding. And then we were just added to 211, I believe, so that we can be an access point there as well.
Awesome. And how does the collaborative continue to assist individuals after they've received funding?
I'm sorry, could you say that again? Your mic kicked out just a little.
How does the collaborative continue to assist individuals after they've received funding?
So because they're already tied in with a case manager, most of us continue doing long-term case management services afterwards. So they stay involved with that case manager, and we follow up with them to ensure that they're staying on track and that we can track how things have actually changed within their lives.
Okay, good.
So a lot of budgeting, kind of self-sufficiency that way, because sometimes as we're getting these referrals, we realize it's, well, they've been using their credit card to pay this bill, where we can kind of then set them up with something else too, so that resource can help them, so they're not putting as much on their credit card and then they're struggling with their credit card payment instead of something else, financial stuff. But it's also, yeah, stability, like depending on, like Ravenwood side would be a lot of the mental health side, drug addiction, same as well as like Geauga. So each of our agencies kind of always brings something different to the table, so they can hit almost any type of population in our county.
What do you think are some of the long-term impacts of the assistance of the collaborative that it provides to individuals?
I think that we're keeping people employed so that they can continue to meet their needs within their own families. So therefore, we impact every single system. So if you're providing a basic need for somebody, you're lessening the burden on a social service agency. That this may be something that allows them to not have to fall into having to use food stamps or cash assistance or a PRC application, or potentially keeping job and family services, child protective services out of their lives. It's potentially doing all those things, or helping a senior citizen not to stay in their own home, which is a huge thing for somebody, or helping somebody who has a criminal background find employment or be able to maintain their life, and truly have that ability to say, I've paid for what I've done. I'm still a human. I still need to be able to function and provide for my family and for myself. So we're truly taking that humanistic approach, and a strength-based approach of keeping people where they need to be and meeting them where they're at, which I think is an amazing thing that we're allowed to do. And for those of us who've been in this community forever and whoever have done this work forever, if you think about how much $1,000 doesn't seem like a lot, but to somebody who's truly struggling, who can't afford to pay daycare for a month, that's huge. And it allows them to kind of take that chance to breathe, and truly focus on what the actual need is and not just the emergency.
I would say it's a lot of giving them their independence and kind of like building up their self-esteem, building up their just comfortability and being able to provide going forward.
Thank you. I have two more questions. Before I get to those, I just want to remind everyone that if you have a question, please put it in the Q&A, and we will begin that portion in a few minutes. So I just wanted to circle back to something you all had mentioned about really giving people a chance to breathe. What are some of the more common needs you're seeing that are coming to the collaborative, specifically among working adults and households that don't qualify for public benefits?
Rent. So I think we've seen since, I mean, it's not new knowledge, that the housing market is atrocious. Right now, we have a lot of clients who are just struggling so much that they can't pay their rent fully. So we work really closely with them and their landlord to figure out how we can make that happen, and trying to get them before they get to a point where they're on an eviction process, because it's really hard to rehouse somebody once they've been evicted. We've seen a big influx, I think, in car repairs again, because we've had a couple programs that have had funding stop because of the current climate. So we've seen a lot more of that again, and
Utilities, we've seen a
utilities, a
lot
lot of
more with the
utilities.
utilities.
Yeah.
We started seeing some more of the school needs, just like assistance with
Mhm.
helping them get set up, like helping purchasing rest of their books or a laptop or something to be able to go back to school so they can further their career.
Mhm.
Thank you.
And medical,
Yeah, medical. Yeah, where insurance doesn't cover everything and having to be able to help with that payment.
So it sounds like a lot of the basic needs, like you said, that people need just to get some breathing room.
Mhm.
Can you also talk about how the collaborative helps assist those who might be experiencing the impact of benefits cliffs?
So the collaborative, we at the collaborative are those who are experiencing that difficulty, we are able to help them with that one-time thing so that they can take, like, so if that benefit cliffs have like them lose like $50 to $150 worth of food, to be able to cover, hey, we'll cover rent so you can kind of balance this out for a little bit so we can give us time to do the budgeting pieces to it. Here in Geauga, we also have several other initiatives, and one of those is also that they're all funded by United Way, including the Food Insecurity Grant, which allows us to do, each agency of those same 7 agencies has a part of that funding. Our agency here at Catholic Charities, we do a one-time grocery shopping trip for somebody who was in with that ALICE population, or if they're applying for food stamps and they haven't been approved yet, to ensure that there's people who are not going hungry within our community, because we want to ensure that that happens as well. And then we also have, also funded by United Way, as a housing initiative, which allows us to be able to help with housing costs as well.
most of our referrals are in kind of the Alice
Mhm.
realm. We have some that may be a little bit lower, but a lot of them are there. It's just that they're making those steps to try and get, but they keep on getting kind of dragged down by either they're not they make too much money for certain programs, or there's just this one-time thing. So it kind of helps them maintain some of that and helps a little bit less of the worry.
I'll give an example. Like I just presented one on Wednesday this week. She's a single mom who works full time, and her electric bill were like $1,000 a month because of an issue with the meter. She's totally responsible for the full bill, but she can't pay that. It's an $800 a month payment, and she's got a 2-year-old child that she has to put in daycare. So we assisted with the utility bill because of those kind of things. So those are the kind of things that we do. And she is truly in that ALICE population, or the family that we bought books for him to go back to school, to get his license as a plumber. So those kind of things are what we do with the ALICE funding that we have.
We do have a couple of questions in the chat. The first one is, how much on average do you provide in financial support to a household on a monthly basis? And how many households do you work with on a monthly basis?
So it is a one-time stipend, and it can be up to $1,000. It depends on what the need is per family. I would say The average is probably right around $500 or $600 though.
Yeah.
We truly do try to be good stewards of our money, and we try to partner really well with other agencies first before we even utilize the money that we have through our collaborative. And again, it's a one-time thing. So sometimes it comes out to being like we're helping for 2 months because we're covering with that much money, but it's truly usually just a one-time thing that affects the family. It's not an ongoing funding source.
Yeah, that's mostly the agencies. If the agencies bring them for the referral, we kind of count on the agencies to keep on following through with the clients to make sure there are no other future needs.
And that kind of coincides with the next question. They just wanted to know more about the logistics of how you all get connected and which organization do they reach out to and how do they get connected with all the services in the collaboration, in the collaborative.
You want to go or you want me to go?
Yeah, I mean, you can always reach out to me, Ravenwoods, simply because we kind of hold the grant. But really, any of the agencies, the point person that come to the collaborative would be able to assist in accessing the collaborative.
And I think now that we're on 2-on-1, that'll make things a little bit easier too, because it will streamline it. I think Sarah's the contact through that. But anytime anybody calls into the agency, I can speak for mine personally, it comes streamlined to me. So if I feel that like if we've got people that we need to present, we present them. Because our goal is to help maintain self-sufficiency as much as humanly possible. So.
And then the collaborative usually meet every other week, so we make sure we catch everyone that has reached out.
And with us having the 7 agencies, and every single one of us having a different kind of aspect or being within different parts of the community, we hit a lot of resources really well, and provide those referrals to whoever's bringing the person in to present.
I don't see any more questions. If anyone has a question before we move on, just please type it in the chat.
Grace, there's a question on response from politicians. So I can take that question.
Okay.
So we testified earlier this week to the Ohio Senate, the Health Committee, on the ALICE data and ALICE priorities in the state operating budget related to ALICE. So we had been, we requested that the legislature support policies like the governor's recommendation of the $1,000 refundable child tax credit, as that would directly impact ALICE households. We also asked them to prioritize increasing eligibility for publicly funded childcare, as childcare is the most expensive line item in a family's budget. We also asked them to fund 2-on-1 at the state level, as Ohio is one of the 3 states that does not have full 2-on-1 coverage for its entire population. And also, all of our neighboring states provide operating funds through their state budget to 2-on-1. Our state does not. And the last area that we advocated for was increasing funding for the Seymour Family Institute, which prevents homelessness for families in 6 counties across the state. Cuyahoga County is one of them. We partner, United Ways partner with the Seymour Institute on this program. And so I think some legislators are very aware and very appreciative of this data. I think others are still not familiar with it, by events like this, and promoting ALICE in the media and engaging with legislators as much as we can. Every time we meet with them, we talk about the ALICE data, we share it with them. So hopefully we'll see some more mention of it. But it still remains to be seen at this point. But if you're meeting with legislators or you're engaging with elected officials, please feel free to share this with them. Use the data to justify why certain priorities and funding needs to happen. and why programs that your organizations are providing are important.
I'll give 30 seconds if anyone has any other questions before we begin to wrap up. I don't see any in the chat right now.
Believe we have another question.
Okay.
What is one takeaway that we would want everyone to leave with today?
Yes.
So Sarah and Sarah, if you'd like to start.
I think for us, for the collaborative, I've worked in Geauga County for over 20 years. This is the first time that I see funding strategically placed to actually make continuous change in people's lives. And that's huge. And for people who struggle to get by monthly, being able to survive is quintessential to their existence, and remembering that everybody is human, and that while these are all numbers, and that's what the translation is, it's not numbers. These are humans. These are people in your community. These are your neighbors, your sisters, your brothers, your grandmother. It's those people that you see every single day, that none of us know truly what the struggle is if we don't have to live it.
Yeah, and I think with this too, it just shows how much we can do to help, what the trends are, so we can prepare ourselves as agencies and be able to assist more residents in Geauga County. It is a rural county. A lot of people are like, oh, has more money than some of the other counties, but really there's still a lot of the other things, which I think this ALICE population kind of captures within our county. Is, yeah, there's some people that do have some money, but there's a lot of people that are just kind of right on that edge, which we get to see more and kind of be able to help us as an agency, but as individuals to then be able to kind of try and figure out creative ways at times to kind of help people going forward.
And just another takeaway as well. I mean, I think Sarah and Sarah really highlighted this, using the data as and the research as a way to tailor a program, to use it as a way to look at eligibility, going beyond things like the federal poverty line, because they don't capture all of those individuals that are truly in need in a neighborhood or in a county. If we were just only looking at the federal poverty line in Geauga, a lot of these individuals that are served by the Poverty Collaborative would not be able to be served. So looking at the ALICE data definitely helps capture those individuals who are in need, who might not be eligible for other public benefits or other programs, but who still need assistance.
The Geauga Poverty Collaborative is available in the 211 database. So if people have questions and want to access one of the agencies that is participating, please call 211 for that need or any other needs. We are here to help. And with that, I want to thank Miriam Kiefer, Sarah Myers, and Sarah Welch for an engaging and informative presentation and conversation. And thank all of you for joining us to learn about the 2025 ALICE report. The 2025 ALICE report is available at unitedforalice.org. As a reminder, the recording of this webinar and the slides will be emailed to all registrants and attendees. Also, mark your calendars for our next community conversation, which is coming up on Tuesday, May 20th at noon, where we will discuss more money for working families, the impact of tax credits. Thank you for being with us today, and have a good afternoon.